Good morning, and welcome to the Castro Country Club. And I really want to, first of all, thank Billy and the Castro Country Club and the whole team for hosting us here today. For those who don't know, Castro Country Club is one of the sort of core community pillars in the Castro. For many, many years, it's been a place where people in recovery or people seeking recovery can come and have a healthy, supportive environment. And this Castro Country Club has saved many, 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 many lives in this community over the years. And so thank you, Castro Country Club, for all you do and for hosting us here today. I'm Scott Wiener. I have the honor of representing San Francisco and Northern San Mateo County in the California State Senate. And we're here today to talk about San Francisco's meth crisis and work we're doing at the state and local level to address it. I'm honored to be joined by our mayor, Mayor Bree, by Supervisor Mandelman, by our Director of Public Health, Grant Colfax, and by amazing community leaders who you'll hear from today. So we have been working all year on providing more state support for San Francisco's work addressing our meth crisis, which is a significant crisis in this city. We know that as of 2019, a majority of overdose deaths were meth related, that most admissions to our psych emergency room at San Francisco General Hospital are meth related. And although we also have big problems with heroin and fentanyl, meth is a significant part of the mix in terms of our addiction, overdose, and overdose death problems in San Francisco. We also know that meth leads to significant behavioral health challenges on our streets with people who are creating unsafe conditions for themselves and for other people, and we need to get people help to get healthy and into recovery. So right now, this year I authored Senate Bill 110, which is sitting on Governor Newsom's desk, and we are calling on the governor to sign SB 110, which will explicitly legalize something called contingency management, which is perhaps or one of the most effective tools in helping people addicted to meth and other stimulants get into recovery. Contingency management is providing financial incentives for people to get sober and stay sober. We know that meth does not have a pharmaceutical treatment to help people get into recovery, like, for example, opioids has their medications you can take. That doesn't exist yet for meth. We hope it will one day. It doesn't right now. And contingency management is a proven tool that the San Francisco AIDS Foundation has been using for a decade, that the Veterans Administration has been using for a decade, and that has proven results in helping people use less or stop using entirely and to get into recovery and stay there and be healthy. So we are calling on the governor to sign SB 110 to allow San Francisco and other cities in California to take this approach, which the Biden administration has embraced. So this is something that we really need to move forward here in California and in San Francisco. In addition, this year in the state budget, I was able to obtain $4.2 million for San Francisco so that San Francisco can open up an additional meth sobering center. San Francisco is moving forward with these sobering centers so that people who are using meth have a place to go to come down, to be in a safe space, to get connected to resources, and we hope eventually to go into recovery. So I want to thank our Senate leadership and everyone in our budget committee who allowed us to obtain this funding for a meth sobering center in San Francisco. We know that people of San Francisco are incredibly frustrated with the situation with overdoses and people dying. We had a record number of overdose deaths last year. It is heartbreaking for this incredibly compassionate city. It is a public health crisis. It is not a criminal problem. This is not about arresting people and cycling people through the system. This needs to move away from the overwhelming of our emergency rooms when we have other tools that can help people without flooding our emergency rooms, and that's what these strategies are about. So again, thank you, and now I'd like to bring up Mayor Breed, who has been and is a true leader on these issues with a lot of different innovative approaches here in San Francisco. Mayor Breed.
Thank you. First of all, I want to just say thank you to Senator Wiener for his leadership in Sacramento on all things that are important to address in San Francisco. And in particular, addiction, we know, is a very challenging thing. He has been leading the fight on safe consumption sites. He has been leading the fight on resources to address the challenges that we face with getting this meth sobering center open, and I really want to thank and appreciate his work, his ability to deliver $4.2 million to help support this facility is going to be absolutely incredible, and we will be opening that center in the Soma neighborhood in November. We have to think about a diverse number of solutions, and it's not one size fits all. I have had, as some of you may know, family members who struggle with addiction. And the last thing that you want to see is someone who you love who is strung out on drugs, out on the streets, or worse, someone that you love die from a drug overdose. We can't just make it disappear because we don't want to see it. These are people with families, these are people who folks love and care about, who have challenges, just like many of us have challenges in life. And so this is really important to me, is very personal, because what we see happening on our streets because of the challenges with addiction is something that we can help to do something about. And part of what we want to do is we want to save lives. Over 95,000 people in this country died as a result of drug overdoses this past year. And we want to make sure, because we saw record-breaking numbers of overdose deaths in San Francisco, and we want to make sure that we're doing everything we can to prevent that. That's why we're here today. We know that we have to think about a diverse number of solutions. And SB110 is really, I think, a very innovative way, again, one that Senator Wiener already talked about is being implemented by the AIDS Foundation here in San Francisco and others, because we have to make sure that we provide as many resources, as many incentives as possible to get people on the right path. And not to mention, here in San Francisco, as we all know, we see, a lot of the addiction play itself out on our streets, and so many people see it and they think, well, we don't want this happening on our streets. Well, if we don't want it happening on our streets, we have to make sure that we have places like the Castro Country Club. We have to make sure that we continue to support Health Right 360 and their incredible work. We have to make sure that people have alternatives. This, crisis of addiction with fentanyl, with, meth, with heroin, and all of these other drugs that, are getting into the hands of folks all over the streets, it's a struggle, it's a challenge. And it's one that we're prepared to meet, but we have to make sure that we have the places, the resources, the capacity, so that when someone says, I need help, we're able to be there. When they're at this meth sobering center, they're just not going to be at this sobering center sitting alone by themselves. There'll be people there to provide moral support, to provide counseling, to provide alternatives, and to try and help them get back on their feet. We want to make sure that every solution possible exists in the city and county of San Francisco, so that as soon as someone puts their hands up and say, I need help, we are right there. We're ready to get them into any treatment that makes the most sense, and that's going to lead to success for them and their life. So I want to thank you all so much for being here. Again, thank you so much, Senator Weiner, for your leadership and work on all of these matters. It is great to have a partner who understands and values the need to do this work, and he has truly been an amazing leader and an inspiration. So thank you so much, Senator Weiner.
Thank you, Mayor Breed. We'll now hear from our San Francisco Director of Public Health, Grant Colfax, followed by my successor on the Board of Supervisors, Supervisor Rafael Mandelman.
Well, good morning, everyone. It's a privilege to have the leadership of so many in the city here and the support of Mayor Breed, Senator Weiner, Supervisor Mandelman. Your work to address our city's overdose crisis and meth crisis is saving lives, and again placing San Francisco at the forefront of compassionate and effective care. Thank you, Billy Lemon, for hosting us today, and your stewardship of the Castro Country Club. For decades, this place has been where people can come on their journey of recovery. So key to the community. And Vitka, thank you for your leadership at HR 360, a tremendous partner as we address ongoing substance use issues in the city, and for your focus on helping us develop the Drug Sobering Center coming this winter. And finally, thank you, Tami Martin, for your advocacy in Sacramento on these key issues that are so important to the LGBTQ plus community. As we all know too well, San Francisco is seeing an alarming number of overdose deaths, and these overdose deaths are truly preventable. And today marks a big step forward in supporting our community who struggle with substance use. Together, we are expanding what we know to be an effective treatment and contingency management, and an effective care model in creating safe respite space like Soma Rise. This is about innovative practices, low barrier to access, and meeting people where they are so that every door is truly the right door for people to begin their journey on recovery. In 2019, I had the honor of co-chairing the San Francisco Methamphetamine Task Force with Supervisor Rafael Mandelman. We came together with community-based organizations, research institutions, and people with experience using methamphetamine to develop a plan. That seems a while ago, but I'm so proud that our top recommendations from the Meth Task Force are taking shape and being implemented. And as Senator Weiner shared, many of the addiction treatments we are using for opioids or other substances are unfortunately not effective for stimulant addiction. A treatment for stimulants that we know works is truly contingency management. And that's what we've been supporting in the health department for many years. Advocates have waited for someone like Senator Weiner with his legislative acumen to make it possible to expand the funding source, contingency management, and therefore serve so many clients. We all want to do the right thing. We all want to implement effective treatments, but I can tell you, making it reality with the SB110 will truly allow us to scale up this effective intervention. We also know that not everybody is ready for treatment. Meeting people where they are, building those relationships, and serving their immediate needs is key. Soma Rise will do that. It will bring people indoors where they can have a safe, welcoming place to come down, rest, and be connected to services. Tragically and unfortunately, fentanyl has changed the landscape of drug overdoses throughout the country and here in San Francisco. Contingency management and Soma Rise are key parts of our approaches, but are pieces of a much larger response. As you know, San Francisco is investing millions of dollars through Mental Health SF. We are filling gaps, innovating, improving access to care, and coordinating services. I want to end with two reminders to our community for ways we can all support friends, family, and neighbors who use drugs or stay safe ourselves. San Franciscans are saving thousands of lives a year with naloxone, a medicine that reverses the effects of overdose. Along with our community partners, we've distributed over 28,000 overdose kits annually. Naloxone and fentanyl test strips are free at our pharmacy at 1380 Howard Street and at community sites across the city. We simply cannot give out too many overdose prevention kits given the pandemic of overdose in our city. Second, the San Francisco Department of Public Health, in partnership with the fire department, has launched 2 teams to respond to people in crisis or those suffering from an overdose: the Street Crisis Response Team and the Street Overdose Response Team. If you see someone in crisis or suspect someone needs support, please call 911 and someone will be there to help them. And now it's my pleasure to introduce a champion of our efforts in our community, Supervisor Rafael Mandelman. Thank you.
Thank you, Dr. Colfax. I will echo all of the praise and gratitude that has been showered on Billy Lemon and the Castro Country Club, because you are an anchor institution here in the Castro and you do amazing life-saving work every single day, and it is an honor to represent you. So this is a great day, and this is great legislation, Senator Wiener. When we had that meth task force 2 years ago, and I know there are some folks here who sat through those meetings, it was not an uplifting or happy experience to have that conversation, because we did have a meth crisis. We do have a meth crisis. We've had a meth crisis for some time, and the reality is that meth is a really hard drug to figure out a good intervention for. And as has been said, the medical interventions seem not to be particularly effective. But when we heard the presentation on contingency management from the folks at the AIDS Foundation, it really was, I thought, a cause for hope and something to feel like, man, oh man, we really need to be doing more of this. And so one of the recommendation number 6, I believe, in the Meth Task Force report, thank you, Mayor Breed, for convening us and letting Dr. Colfax and I co-lead that effort. Recommendation number 6 was to expand out, build out, and fix the Medi-Cal challenges with funding contingency management. And here we are 2 years later, and we need a signature, Governor. But with that signature, we can dramatically expand those efforts throughout California, and that's fantastic. It has been personally gratifying for me to see some of the other top recommendations of that task force report come to fruition or get closer to fruition. The sobering centers were the number one recommendation: a safe place for people who are in crisis on the streets or on the verge of crisis on the streets. Shouldn't be on the sidewalk, need to be in a safe place, and then ideally get connected to services. And we're on the cusp, and I think we're going to need more than one, but one is a start. And then the second recommendation of that Meth Task Force report was better outreach to folks on the streets. And the mayor has made that a priority. DPH have made that a priority. We are exploring many different ways of getting to folks on the streets, not having the police be that first point of contact, but rather folks who can work with people, ideally before an overdose, but even after an overdose, to try and keep folks connected and get folks into treatment. So it's the crisis continues. You can see it every day, out on the streets. It's not just unhoused folks either. One of the things we learned in that, some folks knew it, I learned it. The prototypical meth overdose death at that point was a gay white man in his late 40s. It's a little close to home, but this has been a challenge in the queer community, but it's a challenge for lots of communities, and so we need to move faster, more, do more, not rest until we get more of a solution than we got. So I know we're going to do it. I know the mayor is super committed, and I know I am, and I know everybody here is. So thanks everybody for your efforts, and now we got to do a whole lot more. Oh. After saying nice things about Billy Lemon, I get to bring Billy Lemon up. Billy, we love Billy Lemon.
Thank you, Supervisor. Good morning, everyone. My name is Billy Lemon. I am the Executive Director of the Castro Country Club, a position I've had for about 6 years, and before that I was addicted to methamphetamine. I got sober in 2013 through the help of a myriad of city services that are offered and now supported by many of the folks standing behind me, and most primarily Mayor Breed. We appreciate everything you do. What I want to say, and what I feel is most important, is you don't get a crowd like this in a space like this in a small neighborhood community center unless there is a very pressing issue. Senator Wiener has been a long champion of the Castro Country Club. He helped me get a workforce development program funded in 2014 because here's the deal. I got sober with the help of PROP at the San Francisco AIDS Foundation. At the time, I was homeless. I had a backpack, and I walked into the offices of Rick Andrews. Hi, Rick. At that time, Rick was the director of PROP. I invited him this morning, and PROP worked for me. PROP is a Positive Reinforcement Opportunity Project, right? And basically, it allows somebody to get a negative test from methamphetamine over a period of time, and those little incremental rewards for somebody who was a stimulant user is an effective treatment. And that combined with a whole host of other things, abstinence, maybe not abstinence, it all kind of congeals together over time, and eventually folks find their way. And they find their way because San Francisco is a compassionate city. Ignore the haters, right? San Francisco is a compassionate city that cares about moving folks forward. Everybody up here cares about moving folks forward. And what I hope is over time that through the fantastic work of HR 360, sobering centers, places like the Castro Country Club, we can meet folks where they are and provide them a myriad of options to help them kind of get their substance use to a position where they feel comfortable, right? That's what I do every day. And I am a living, breathing example that if you offer a helping hand, that eventually folks will figure out a way to make it work for them. And so I really want to thank everybody up here, Rafi, Dr. Colfax, Vika, Senator Weiner, and especially the mayor for funding our workforce development program. Thank you. We very much appreciate it. We know that you have a lot on your plate, and it really, you are changing lives every day. And so I'm very heartwarmed to have you on the premises in the sacred space. So thank you, everyone.
And our final two speakers will be Vika Eisen from Health Right 360 and Tami Martin with Equality California.
Thank you, everybody. Can you all hear me? I'm short. Thank you, everybody. Thanks, Billy, for having us here. You know, I am grateful to live in a city and a county that believes in science and follows the research. And that is no small thing in this era of COVID and the pandemic and how our city responded. But it's also evidence, it's also demonstrated by how this city and how our state has responded to drug use, to drug overdoses, and to problematic drug use. We follow the research and we follow the evidence and the science, even when it kind of defies our beliefs, closely held belief systems, even when it defies what's something we might have read on the internet. Contingency management, under SB110 from Senator Weiner, follows the science. It follows research on effective interventions for people who use methamphetamine. Now you have to realize, Health Right 360 has been around a long time. I've been doing this work a long time. Health Right 360, then Walden House, was a partner in a research project on contingency management back in the late 90s. Now I'm an old treatment person, so the idea to me of paying people to not use drugs seems strange. But I said, hey, it's research, let's go with it. And so what did we find? It was effective. So did I say, well, it's effective, but that's ridiculous? No, we said, follow the research. We need to invest in things that work, even if they seem unusual to us or unexpected, or it's not the path we thought things would take. So I'm grateful to live in a place where we have a mayor and senators and board of supervisors who are willing to do that. The Soma Rise project, of which we are very grateful to be a part of, is also evidence of following research on low barrier, low threshold interventions for people in drug crisis. For people in drug crisis, what we want to be able to do is to meet them where they are and connect them to care. That works. That research that shows that works There's also personal experience that shows that that works. You heard Billy's story, my own story. I'm a former drug user. Way back in the day, I went to Haight-Ashbury Free Clinic's detox program. I must have been to their heroin detox program. They had a very low barrier drop-in detox program. I must have gone 9 times. I felt welcomed every single time. And eventually, because they cared about me and I trusted them, I went to treatment. And so we look at Soma Rise as a similar opportunity to engage people who feel like that nobody cares about them, that people hate them, that people are afraid of them, that people think they're sick, people think they should be in jail, that people are filled with so much self-hate and shame and live in such misery that we will greet them, excuse me, with love and compassion and some food and a shower and a warm place to be. And we'll do it over and over again until the point in which they say, hey, we need something else. We want to do something else. And when that minute comes, when that second comes, we will be there to connect them to CARE. We'll connect them to SFA's project. We'll connect them to Health Right 360. We'll connect them to Hummingbird, any service that will help them along a path to health. We will be there to do that. And we are facing an unprecedented crisis in overdose deaths, including a rise in people who are overdosing and dying from stimulant use. These are just steps to take, but we are proud to be a part of a movement towards really, really doing anything it takes to taking care of people who use drugs and improving the life of people in San Francisco. Thank you.
Good morning, everybody. Tami Martin, Legislative Director of Equality California. And every day I go to work to push back against discrimination, against stigma, and against shame. And those are just a few of the barriers that prevent people from accessing treatment that they need to overcome addiction. But I'm honored to be here today to represent the over 900,000 members of Equality California, which is the nation's largest statewide LGBTQ+ civil rights organization, and to work alongside the incredible organizations who are also co-sponsoring SB110. And together, we all join Senator Wiener in urging Governor Newsom to sign SB110 and to combat meth use, which is a longstanding crisis in the LGBTQ+ community. And in advocating for this bill over the past almost 10 months now, I've met with a surprising number of people who were not aware that this has been a longstanding crisis in the LGBTQ+ community. And that lack of awareness is yet another barrier to treatment, and another reason that stimulant use has grown so rapidly. And meth is often presented as a party drug in the LGBTQ+ community, but as we know, it all too often becomes deadly, accounting for roughly 60% of overdose deaths in San Francisco in 2019, and the mortality rate is high among African American men. So SB110 is not just a public health priority, it is not just a priority for the LGBTQ+ community, it is also a racial justice priority. And in good news, as we heard, this year Senator Wiener also secured a significant state budget investment for a drug sobering center right here in San Francisco, which will provide a trauma-informed space for people to access support. And Governor Newsom has already shown a strong commitment to helping solve this crisis by approving that budget investment, and that's why we look forward to his signature on SB 110, which will provide another critical tool in reducing meth addiction and saving the lives of LGBTQ+ Californians. Thank you.
Thank you, Tami. So now I want to thank everyone for being here. We're happy to answer any questions that members of the press may have.
Mayor Breed, there's currently a resolution at the Board of Supervisors Committee urging you to call for a local emergency on overdoses and then immediately implement overdose prevention sites. Is that something you're supportive of calling for a local emergency on this?
What I plan to do is exactly what I've been doing, and that is making sure that we're focused on action and investments. This pandemic, when we were hit with this pandemic, we used the powers of a declaration of emergency for the purposes of addressing this issue. And We know that there are challenges with drug overdoses that are, of course, problematic, and this is definitely a public health crisis, and the solution is not necessarily a declaration of emergency. The solution is putting resources and putting forth action towards addressing this issue. And so we are doing what we can to invest significant resources in combating this crisis. And to also be clear, ever since I was on the Board of Supervisors, I have been trying to push to open a safe consumption site, and we have been experiencing a number of challenges. Senator Weiner has been pushing for the state legislation that would allow for us to open those sites and avoid people losing their licenses and other challenges that may come their way. So this is not an issue that San Francisco is going to be able to combat alone. This is an issue that we're going to have to continue to work with our state representatives to try and get the job done. And I think, with the investments and the advocacy that we have here today, every single day we're going to continue to push in that direction.
So if this resolution makes it to your desk, you would not support it?
I cannot confirm that at this time because I haven't had a chance to review the resolution.
And I do just want to reiterate that SB57, our state legislation to legalize safe consumption sites, is moving still forward. It will move forward in January. Governor Brown vetoed it in 2018. We're determined to put it on Governor Newsom's desk next year. Any other questions?
Mayor Bree, Governor Colfax mentioned that if we see someone in crisis, the avenue should be to call 911. Advocates for the homeless express concerns that the police are still responding to too many calls that involve nonviolent situations involving the unhoused. Should there be a different avenue so people can get the street crisis response team or another alternative?
Well, no, there shouldn't be. And to be clear, what has not been said today is that almost every single day, San Francisco police officers are providing Narcan to those who are experiencing overdoses, and they are also saving lives. But what happens when you call 911, the dispatcher analyzes the call to determine who should come out. So, for example, we have the overdose response team, but if they're not available, we need to send someone sooner rather than later. We can't wait. And this is a new vehicle. A number of the things that we're putting in place in terms of the street crisis response team, the overdose response team, the wellness checks, we have just put those things into place, and they're working very effectively when they are able to respond. But they're also very time consuming. So it's not like you can just show up to a scene and say, get in an ambulance and let's go. Sometimes it can take an hour or 2 hours for one individual to get support because it requires patience and it requires an understanding of what that person is actually going through. So if none of those groups of people are available to respond in those teams, and someone is calling 911 and it's a crisis, we're going to send what we need to send in order to try to help deal with the situation. And it should be noticed, again, that there are officers out there with Narcan that are helping people too. And I get it. There are some folks who have a problem with it, but at the end of the day, it's going to take all of us to work together to help address this crisis. And I apologize, but I do have another thing to go to.
Thank you.
Thank you.
Any
Final questions?
Sorry, quick question for Dr. Colfax on another note. Dr. Colfax, where do we currently stand on the indoor mask mandate? Is that something you guys are discussing repealing at this point?
So the indoor mask mandate is still in effect, and we're in discussions with our health officer and other scientific experts looking at our numbers and figuring out where there may be flexibility. Right now we're on a positive path downward in terms of cases and hospitalizations, and we're looking at it, and we're going to be continuing to determine the best time to potentially roll back some of the indoor masking mandates, but right now we're not prepared to do that.
Do you have a timeline as to when?
I don't have a specific timeline to share. Thank you.
Great.
Could you expand a little bit more on where we stand in San Francisco in terms of that positive path that you're referring to?
Well, our cases have been dropping. We're almost at half the statewide average. As you know, the state is doing very well, but right now we're at about 11 per 100,000 cases. Our test positivity rate is below 2%, and that's the first time it's been below 2% for a number of months. We have about 60, 65 people in the hospital on average on any given day, so our healthcare system is well positioned to continue to care for people. I think the most important metric is our vaccination rate. So we're at 82% of people eligible to be vaccinated. And in relationship to how we all get back to a ongoing, safer environment, the new normal, we're really excited about the 5 to 11-year-olds being eligible for vaccine. We expect the end of October. That'll be a major step forward, especially in allowing children to continue that in-person learning. So really excited about that. Thank you.
What metrics are you looking for in regards to the indoor mask mandate? Are you looking for us to hit a certain case rate or to hit a certain vaccination rate?
It's a combination of factors, so it's looking at that in lieu of those variables that I just talked about.
Do you think it is the vaccination rate that's most contributing to San Francisco being on a better path?
Oh, I think it is. I mean, if you look at our vaccination rate at 82% of eligible, I mean, we're higher than most jurisdictions. And I think you also see that fact that in the hospitalizations among people hospitalized, people without vaccine are 8 times more likely to be hospitalized with COVID than people who are fully vaccinated. So these vaccines are saving lives. They've saved lives in San Francisco and will continue to do so. So the message is, if you haven't gotten vaccinated, please get vaccinated. We have drop-in centers across the city. We have nearly 100 vaccine sites, usually within a 5 to 10 minute walking distance for any San Franciscan.
Great. Any final questions?
Can I ask on the topic that we
Yeah.
started with, perhaps where Dr. Colfax already went on the panel, we heard a lot about the unprecedented crisis of overdose deaths. What is contributing to that unprecedented crisis?
It's spiking everywhere. This is throughout the country, throughout California. It's not, San Francisco is not unique. And I think there are, we were already, we talk about death of despair, people who feel like they have no other options, lack of support, and the pandemic made things worse because there was less access to services and to help. And so, again, this is not just a San Francisco problem. It might be more visible here because we're more concentrated, denser city, but it's happening absolutely everywhere in rural areas and in urban areas, suburban areas. And that's why this SB110 received a unanimous bipartisan vote of support in the Senate and almost unanimous in the Assembly. Was not controversial, and it was very bipartisan in support because every community is suffering. Okay, thank you very much, everyone.